Welcome to One on One with B'nai B'rith International. I'm CEO Dan Mariaschin. Welcome to the program today. Thank you for tuning in. I hope everyone is staying home and taking good care of themselves. We hope that our conversations will help ensure that physical distancing doesn't turn into social isolation. Well, I'm pleased to have as my guest today David Michaels. David is B'nai B'rith's Director of United Nations and Intercommunal Affairs, with responsibility for the organization's work at the World Body and in interfaith engagement. In this conversation today, I'll be asking David about the coronavirus, whether it's affected B'nai B'rith's UN initiatives, how the virus has changed the UN's priorities and deliberations, and what impact this crisis has had on relations between member states. We'll also talk about the World Health Organization's role as this crisis continues to worsen. David, thank you for joining us today.
Great to be with you.
Well, the coronavirus outbreak has affected everyone, all of us. How has it impacted some of B'nai B'rith's key initiatives at the UN?
Well, for our work at the UN, coronavirus couldn't have come at a worse time. March is a very, very busy month, as you know. We were scheduled to travel, among other places, to Geneva and to Paris for the main yearly session of the UN Human Rights Council, as well as for high-level meetings in advance of the executive board session of UNESCO, the UN Educational, Cultural, and Scientific Organization. And we had dozens and dozens of meetings, literally, in each of those hubs, with ambassadors and other senior diplomats accredited to UNESCO and to the Human Rights Council, as well as meetings with high-level leaders within both institutions and other bodies dealing, for example, with the Iranian nuclear file. So the world doesn't stop. The world's problems don't stop, even with this incredibly global and pressing emergency that's confronting us right now. But our work and the work of UN institutions themselves have been profoundly impacted, at least in the immediate term, by the pandemic, and we're all in the position of finding ways to acclimate and to adjust, because the work has to continue.
In the meantime, and of course everyone is justifiably preoccupied with the coronavirus, but in the meantime, are we using this time to make the same points that we would have made in person? Are we using other means to get our message to the same folks that we would have been meeting in Geneva or in Paris?
We are. The generation that's labeled millennial has gotten a bit of a head start, but I think everyone else is catching up as quickly as possible. We're, as I said, the work has to continue, the problems continue, the responses have to continue. And so wherever possible, we're shifting our efforts to the virtual sphere, at least for the time being, in light of that concern over social distancing that you made reference to at the outset. And in some ways, we're doing more than we had previously. There's simply a different emphasis. There are some different emphases at this point. And as this progresses, I'm sure we'll find more and more ways to be active, as we have to be. We closely monitor, for example, anti-Israel bias online, in international bodies, in the media. Unfortunately, and this is something that B'nai B'rith has been very vocal about, as at so many other times throughout history, bigots, anti-Semites, and others have taken the opportunity to capitalize on the pandemonium, on the panic, on the fear, on the uncertainty of this moment to find scapegoats. And as at so many other times in history, particularly at times of public health crises like pandemics, anti-Semites are finding and seeking ways to spread conspiracy theories about Jewish or Israeli responsibility for this terrible challenge that doesn't discriminate against any religious or national group. And so B'nai B'rith has spoken out very publicly on this, has monitored it. One thing that distinguishes our organization is our international scope. So we're not simply based in the US, we're headquartered here. We're not simply based in New York, where I'm located at the moment. We are a global organization, and that presents us with challenges because our communities are suffering on virtually every continent, but also with opportunities to have eyes and ears on the ground, even at this time, and to find ways to meet needs and to address needs where we can.
Well, you're right there, as you say, you're right there in New York. You're a few blocks away from the United Nations itself. But of course, the business of the UN continues to go on. And there was a very interesting comment from the Secretary General of the UN, Antonio Guterres, um, almost kind of out of the blue, or I should say unexpected, another way of saying it, about the cooperation between Israelis and Palestinians during the time
Absolutely.
of the coronavirus.
Yeah.
And we did respond favorably to that, to the Secretary General's comments. Why don't you comment a little bit about that?
Sure. Well, there have been a number of UN officials, including the special envoy for uh, whatever nominal peacemaking between the two sides that we've seen over the recent period, commending both the Israelis and the Palestinians for their engagement, their cooperation at this time. If all of us in the international community, between Wuhan and New York, between Tehran and Jerusalem, are impacted so quickly and so dramatically, so frighteningly by this situation, we can only imagine how Israelis and Palestinians, so intertwined in a country, a land the size roughly of New Jersey, which is one of our smaller states here in the U.S. We can imagine just how intertwined the circumstances and the fates of those two populations are. So this is an important sign. The U.S. Representation here at the UN has rightly pointed out that whatever cooperation we've seen between the two sides just goes to show, and it's born of necessity. Just goes to show that when push comes to shove, they are capable of engaging, and it's only when they engage bilaterally that positive things, necessary things, occur for the people on both sides. Now, unfortunately, I'd have to add, and this applies. I'm looking at the UN right now, even in the UN settings, although some of these meetings have shifted to video conferences rather than in-person meetings, even by now at this early stage, in the relatively early stage in the pandemic. Palestinian leadership, both fringe and more establishment, more mainstream, have continued to incite against Israel, not only to continue to incite against Israel, to glorify violence and terrorism against Israel, and deny Israel's legitimacy.
And to join these conspiracy theories. I mean,
Join
you're right. I
conspiracy.
mean, at the same time that there is this cooperation on the ground, the drumbeat, which is consistent and over decades, this drumbeat against Israel, now kind of fine-tuned and calibrated to the coronavirus, continues.
And your point is just right. Specifically, and this is just obscene. I don't think there's any other word for it. They have accused Palestinian officials, the Palestinian prime minister has accused Israelis of spreading, of being responsible for coronavirus. Palestinian media have compared Israelis, talk about dehumanization, compared Israelis, even amid all of this, to coronavirus, said that coronavirus will not stop them from engaging in conflict against Israel. Now, you can imagine that if Israelis were to be doing that, if Prime Minister Netanyahu were to be engaging in that type of rhetoric, that type of incitement and dehumanization, particularly at this moment, the entire world, with all of the distractions, and especially the world bodies right near where I'm sitting right now, they would be up in arms. They would be up in arms. But there's a double standard. That said, as the Israeli ambassador here to the UN, Danny Danon, acknowledged on a number of occasions over the last few days, this is not the time for divisiveness. We're forced. This isn't an option. We're forced to put aside those things that we disagree about, to put aside the contentious issues, and to try to save lives because the stakes are that high.
Well, let's move to another agency of the UN. You talked about our annual visit, very important visits to Geneva, to the Human Rights Council, and to UNESCO in Paris, both places that have a feature kind of built in to their program when it comes to bias against Israel. But let's talk about the World Health Organization, because it's been so much in the news because of the coronavirus, but also because of some of the comments that have come from its leadership. Um, Tell us a bit about WHO,
Sure.
how it fits into the UN system, and what you've been observing about the comments of the agency during this period of crisis.
Well, this experience, this period, this chapter really is going to be a case study and potentially make or break to some extent the credibility and the standing of international institutions moving forward for the foreseeable future. They all have a very, very difficult job. And by they, I mean not least the leaders and the staff members, the experts working within these organizations. The WHO has long been a particularly respected body. It's never been perfect. It's never been without limitations. I can talk about some of them, and they apply across the board within the UN system and in the international community generally. I mean, budgetary limitations. There never are enough resources. We know how great the needs are, even in the best of times, particularly at a moment, even in 2020, when conflicts continue around the world, when poverty continues and other diseases continue around the world. There's such need. So they're limited in that way. They're also limited in the way that they can spend the money that they have. Roughly 80% of the WHO budget is voluntary. Only 20% is comprised of dues. And the 80% that comes not even primarily from governments are included, but also from major civil society institutions like the Bill and Melinda Gates Foundation, often is provided generously, but earmarked for very specific needs. And as we know all too well, at a moment like this, needs can suddenly change, but the flexibility doesn't exist within the organization, either generally in terms of mandate or specifically in terms of the use of resources to quickly shift the funds as needed. So the Gates Foundation, to take that example, has very famously prioritized fighting polio. WHO has played a key role in fighting polio previously, and for a very long time, the WHO played a heroic role in combating smallpox. But they can't. They simply don't have the ability as of this moment. And I'm no expert on the WHO specifically in its functioning, but they don't have the agility to simply do what they want with even the limited resources they have. Another constraint on the body, and this is the problem par excellence of UN institutions, is that even the director general or the secretary general of a given agency or the organization as a whole is not the boss. That person has a boss has roughly 193, or in the case of the WHO, 194 bosses. He's answerable to member states. These figures are dependent on support, on legitimacy, on access, on cooperation. Their decisions are not binding, certainly in the case of the WHO. And these bodies, intergovernmental bodies, political bodies, are going to be political. Each government has its own agenda, its own approach, its own interests. And so critics of the WHO, and I can speak to the Israel element as well that we've focused so heavily on over recent years, critics of the WHO have said, rightly, that politics can get occasionally in the way. And some have said that applies even in the case of this terrible coronavirus pandemic.
Let me ask you specifically about that, because yes, we have tracked it over the years, and we both agree that some UN agencies have become highly politicized, and some are less so, and some more or less do the work that they were that their mission has set out for them. Now, we talked a little bit earlier about the scapegoating of Israel and Jews, Zionists, in terms of the coronavirus. Have you seen anything from the WHO that would say to those who advance these charges and this scapegoating, now wait a minute, that's you're not only are you're off base, you have crossed a red line, you're scapegoating. Do you see any of that? I mean, has there been any help from the WHO in that regard?
Well, the General Assembly, the WHO falls under a UN body called ECOSOC, the Economic and Social Council. with which B'nai B'rith has accreditation and has for nearly the 75 years of the UN's existence. The General Assembly has now passed one of two proposed resolutions in response to the coronavirus. The Security Council is its own can of worms in terms of its ability or inability to get involved on this issue. And some would say that that would be appropriate in light of the very, very real risks at this moment, international peace and security. Others would say that the focus should remain at the WHO. The General Assembly has already passed one resolution, not only expressing global solidarity and solidarity with those suffering under the coronavirus or from the coronavirus, but opposing xenophobia. And this is something, as we've discussed a few minutes ago, that the Jewish community has suffered already, and the Asian American community, the Asian populations in many different parts of the world, especially in the early phases of this outbreak, where it was associated, or the perceived association was with Wuhan and with China. Terrible blowback against innocent and healthy Asians and people of Asian descent. So the General Assembly has passed that resolution, and the WHO has spoken out strongly against that type of scapegoating and stereotyping. Now, in terms of, the WHO, as other bodies, is comprised, in the labyrinth UN system of different components. There's the executive board, which is more professional, made up of experts and specialists. And then there's the supreme body, the World Health Assembly, which, as mentioned, is comprised of 194 member states. To speak to your point, that body, as other critical bodies, or bodies that should be critical, like the Human Rights Council, the math against Israel is simply so daunting. And what does that mean? That means that you've got one Israel with a few good friends and a few principled friends, but you've got dozens of Arab and Muslim member states that automatically most of them work very closely with the Palestinians to weaponize these bodies against Israel. And in the most overt exploitations of critical bodies dedicated to health, dedicated to human rights, the Commission on the Status of Women, it would have taken place had their meetings not been cut back just this past month here in New York. These bodies, one after the other, because of that daunting math and that explicit overt politicization, have singled out one country and one country alone for condemnation, Israel. And we know that Israel, of all of the countries of the region and most countries of the world, has tremendous regard for human rights. We know even more so that Israel is a world leader, not only in developing and practicing advanced health, but also sharing its know-how and assets, despite its small size, with the rest of the world. We know that Israel is a world leader in women's rights. Its opposition leader, its past prime minister, its past Supreme Court justice have all been women. And despite that, bodies like the Commission on the Status of Women, bodies like the Human Rights Council, and yes, bodies like the World Health Assembly have had dedicated agenda items and dedicated condemnatory resolutions targeting only the Middle East's sole democracy.
And I suspect that when all of this is over, we will be back to business as usual. David, you mentioned, and this is a good time for us to mention this. You mentioned ECOSOC, which is the Economic and Social Council, and you're quite right. Even though B'nai B'rith was present at the founding of the United Nations in San Francisco in 1945, it was in 1947 that we received our first credentials as a non-governmental organization. Now 73 years. And that was within ECOSOC. So our membership there, in terms of our history and our participation at the UN, of course, really began in that place. I'd like to shift to another aspect of your portfolio, if we may, in the closing minutes here. We've talked about the UN. Let's talk about the interfaith community, the interreligious community. There has been a lot written every day how the coronavirus has affected attendance at religious services, the impossibility for people to gather as they normally do for their weekly or their daily religious services. And we read also that church and synagogue groups, of course, are reaching out, just as B'nai B'rith does, through means of social media and the internet, as we're doing here today. What are you seeing in the interfaith community that might be of note during these days of crisis?
Sure. Well, it's a great question, and there's a lot to be said. We could probably dedicate a full discussion to that alone. As you know, as our viewers probably know very well, we're approaching some very important religious holidays in our own community. Passover, normally a time not only of very intensive family and communal preparations, but a time of communal prayer, a time of families coming together, probably more than any other holiday of our year. And so this has been incredibly disruptive. I think it's been incredibly traumatic for many people for whom this is a first in a lifetime experience. We're approaching the 75th anniversary of the end of World War II and the Holocaust. And in religious terms, in terms of disruption of religious life, this is probably unprecedented. And in its global scope, I would go so far as to say that even preceding World War II and the Spanish flu epidemic of a century ago, this may well be unprecedented in scope. And we're just at the beginning, and we're hoping and praying that it goes well. That said, faith communities, faith leaders, faith institutions continue to play an incredibly important part in managing people's anxieties, in providing ready-made networks for people to stay connected even at a time of physical social distancing, in-person social distancing. Some have been more compliant with that than others, and that's a challenge that we encounter in many, many different communities and outside of faith communities in terms of compliance. Some find it, and without getting into any theological discussion here, the importance of religion in people's lives is such, all the more so at a time of uncertainty and anxiety like this, that people feel the need, more than on a regular Tuesday or Wednesday or Saturday or Sunday or Friday, to come together, to pray, to look to their faith system, to their beliefs, for comfort and for salvation, quite frankly. Let me go beyond the aspect of prayer and comfort and community. Faith communities in so much of our world, perhaps a little bit less so in what's described as the Western world, which is now comparably secular, Western Europe and North America. In so much of the world, it's faith institutions that provide not only religious services and context, but also social services. These are the bodies that either on their own or with others are delivering supplies, are helping with food and medicine, that run institutions, that run medical facilities and schools. So they're as vital as ever. And I can tell you, going back briefly to the UN context, the UN famously among some, or infamously among some, has been or was for a long time very resistant to anything related to religion. And that's changed a little bit. We don't have time now to get into the reasons for that. It's changed a little bit over recent years, but I think now, when the Secretary General and others at the UN have pushed forward plans, multi-billion-dollar plans and appeals for global aid, particularly in developing and underdeveloped countries, they've focused more and more on NGOs and on private citizens, not just governments. Now at a time of acute need within the UN and outside, all of a sudden we see the UN looking directly to individuals for money and for support and for volunteering. That it hasn't been that way in the past, where it was governments that had a seat at the table. So I think that faith institutions, certainly faith-based institutions, a Jewish organization like ours will be, and a Jewish organization like ours that has boots on the ground on 6 continents, literally, will be looked to disproportionately as partners in every manner of response to this type of public emergency.
Yeah, I think you're absolutely right. And one of the things, the whole notion of nonprofit organizations is an interesting one because the growth of nonprofits around the world really has largely been centered in the United States. That nonprofits, in so many respects, and you've talked about the various areas. I mean, in terms of the founding of hospitals in this country and other social services, as you quite rightly point out, that in a way, Americans have pioneered best practices. But we have today the growth of nonprofits engaged in this activity around the world. And you're absolutely right. When we see shortages here, the need to deliver food packages, the need to provide psychological counseling at a time like this, many of those who are the practitioners in this field come from the nonprofit field. And I think you're right. I think that once this is over, there will be not only an appreciation for what nonprofits have done, but also a big push to continue the funding of these organizations because they help so much and they relieve, in many respects, they relieve the burden on governments. It's a partnership that perhaps we've taken too much for granted, and your point really is well taken. Well, David, I see that our time is up. We will do another one of these programs. We'll choose another topic. Perhaps we can delve more into the interfaith community and what some of our challenges are there in terms of our Jewish community in the state of Israel. And we'll certainly pick it up again. But I want to thank you before closing for all that you and your colleagues do at the United Nations. This is a very important program for B'nai B'rith, and it's an important program in terms of advocacy for Israel, which receives such biased treatment in that organization. So thank you for joining us. Thank you, everyone, for watching One-on-One with B'nai B'rith International. Please visit our website, bnaibrith.org, like our Facebook page, and follow us on Twitter and Instagram. And lastly, tell a friend about us. For my colleague, David Michaels, I'm Dan Mariaschin. We'll talk to you next time on B'nai B'rith International's One-on-One. Stay safe, everyone.